So now we're going to talk about the different laser options we have to treat glaucoma. Remember, glaucoma treatment is all about your eye pressure. We want your eye pressure to be lower and not higher. So we have laser procedures that we could offer to achieve that goal. So laser is a short name for selective laser trabeculoplasty. Another way of saying it is SLT. That's another probably more common way for you to hear it. We do SLT laser in the office, not in the operating room. So you will come in very much like your office visit, where patients will have their vision checked and their pressure checked, and then we apply some eye drops in your eye as a preparation for the laser. Then you go into the laser room, set up very similar to this exam room, and you get your laser done within 5 minutes. Usually we don't need you to be on any medications afterwards or any drops afterwards, and there's no major precaution after the procedure as well. Life essentially carries on as usual, and pressure will be reduced as a result of the laser procedure. So that laser procedure does not create any scar. It doesn't burn anything, cut anything. It doesn't cause any bleeding in the eye. The goal of the laser is that the laser energy is absorbed by the pump cells aligning the angle or the drainage system of your eye, where it's nudged to work more efficiently in pumping fluid from the inside of the eye to the outside. Once that efficient flow is established, your pressure will come down nicely. The laser is not supposed to be an everlasting process. It does wear off over time. Just like everything we do in glaucoma is really not meant to be a permanent fix to the glaucoma problem, because we can't really permanently cure glaucoma. Everything we do is trying to stay ahead of the game in managing your eye pressure so glaucoma doesn't deteriorate too fast. This laser specifically, like I said, target the pump cells of the eye. You don't feel anything, you shouldn't have any pain at the process, and you shouldn't feel any pain afterwards. Maybe a little light sensitivity and soreness in the eye as a result of mild level of inflammation in your eye. And that's actually what we encourage the eye to have. Inflammation in a way also means remodeling. So the laser energy triggered the pump cells to remodel on a cell level, which it then can work more efficiently to drain the pressure in the eye. Over time, with thousands of people getting through this laser, which is a very established laser, we see on average the effect of the laser can last up to 6 to 7 years, which is really a good extended period of time, which you may actually stay off of your medication or eye drops and still have great pressure control. Once the laser wear off, which it always does, it's just a matter of how long you have as an individual the laser to be effective on you. And over time, we may be able to repeat the laser for one time or maybe for a second time, depending on whether you're a good candidate. It may get to a point where we say laser is no longer a good option for you. And at that time, we either have drops to fall back onto, or we can move on to the minimally invasive glaucoma surgery or mixed procedures that we talked about earlier.